The goal of everything we're going to talk about today is, of course, to be able to connect more deeply with ourselves, our loved ones, and the world around us. And I used to ask my patients who came to me for functional medicine, what symptoms do you want to get rid of? And then I actually started asking, okay, once your symptoms are gone, what do you want to do when you're feeling better? And that sort of reoriented them. And so my first teacher, Michio Kushi, 30 years ago, who understood more about the microbiome and healing the body, he really taught us about how to be in coherence within our own bodies by reducing the amount of threat, essentially, and how to be in coherence with our environment by, for instance, eating communally or to eat foods that are grown locally, right? Now, that might not be something that's accessible to everyone, but it was really remarkable the changes that we saw in all diagnosis, mental health, physical health. So this led me to understanding a couple of years back, many of my friends are therapists in every different field, and my colleagues and friends were burning out, right? And so what I found was that I used to say, the first 5 years out of school, we're so happy to get paid, right? We're just like happy we're making our finances. And then as we go on, after a couple of years, we figure, okay, we can raise our prices, patients are doing well, clients are doing well. And then if our clients are not doing well, if our clients are presenting with stalling or plateauing, then no matter how much we're charging, no matter how much we're getting back, we're not feeling that reciprocal healing that we got into the field to do. So when we're not seeing progress on a consistent basis, that is also what contributes to burnout. And, I'm not telling you anything that you don't know. It's more about what I see from the physical side is clients and patients and everyone, including us, we are more physiologically complex now than we were in the past. We have more input coming to us, and we're going to be talking about that. And so much of what I talk about, it's the 1% rule, whereas if you have a plane that's leaving LA, heading to New York, and you're off by 1 degree, essentially you end up miles, tens of miles, hundreds of miles away from where you meant to go. And we have found that by adding 1% changes in, it actually changes things in a majorly compounding way. So we're not asking, when I work with people, I'm never asking them to change everything, overhaul everything at once. It's just giving selections. The amount of selection matters, right? Depending upon where someone's nervous system is. Sometimes I'll give a lot of choices if that's what that person needs, and they pick the one change that week or that month that feels accessible and easy. Or if it's someone who gets overwhelmed by a lot of choices, then I just might say, try this one. And so the concept here is that everything is information, and everything we get from our internal and external world is at a metabolic cost that our system sometimes struggles to pay. And so what that means is our visual systems, our auditory, we're going to get into the sensory, but every single cue from the environment that we are not even aware of is actually draining our metabolic reserves. It lessens our capacity. It makes us more in a state of sympathetic concern that something is going to go wrong. Our neuroception, right? Dr. Porges's word, the lens that is constantly scanning our environment for are we safe or not, it actually alters that lens. And so, this is one of the things that I talk about a lot, is that people are presenting with more chronic inflammation, gut dysregulation, and heightened autonomic activation than they ever have in the past. And whether that is because of things that they have experienced, or whether it's things that they are experiencing on a moment-to-moment basis that they're processing and don't know is impacting them. And the reason that that makes such a difference is because the threat response to a thought, to an experience, or to what we're processing is always going to result in the same thing. And what's really interesting is that, I'll tell you, last night my son said to me, Mom, I think I need new deodorant. And I was like, why? He said, by the time I get to school, I'm sweating. I said, well, that's interesting. Tell me more. And he said, well, when we turn the corner to school, boom, I start sweating. And I was like, okay, so is it possible that he calls it the automatic nervous system instead of autonomic. I said, is it possible your automatic nervous system is actually stressed and it has this effect when it sees the school? And then you start to notice, oh, I'm sweating. And then you start to experience, the concern about being there. You start to notice that you're concerned rather. And he's like, yeah, I think that's it. And so our symptoms tell our story from both the past and present. And our brain uses past and prediction to decide what's affecting us in the moment. And I should say, this works more effectively if we have the correct language to name our experience. So most people are not thinking that the flickering of the light above me is actually really stressing my nervous system. Those lights turn on and off 100 times a minute. We don't notice. We may not notice that the sound of the HVAC is at a frequency that is actually cueing our threat system, right? Stephen Porges does a lot of work with this with his safe and sound protocol. So by naming that, the food that we just ate can also create inflammation in our gut, which immediately triggers a whole cascade of chemical cocktails and directly informs our autonomic nervous system in real time and can in fact create anxiety in the moment. It can create stress. And our brain, if we don't know these things, struggles to name what is causing this now, and sometimes assigns meaning where it's not actually specifically tied. And so these are just things, this is really about orientation, because everything I'm going to talk about is with the awareness that everyone's scope is different, but this is information that can be very beneficial simply by naming. I've helped set up a couple of, one is a neurointegrative clinic, and I remember what I had them do was, if someone was coming in, let's say for TMS or neurofeedback, acupuncture, a psychosocial, biopsychosocial, no matter what they were coming in for, I had them set up an iPad that would give a little video, just three minutes, and let someone know ahead of time, when you come into this room, here's the process that will happen, and here's the 30-second version of why this therapy is potentially useful for you. And what that does is it primes the nervous system, right? It says predictability. This is what's about to happen. I can relax right now. And, oh, this is what's going to potentially do in my body in a way that's beneficial for me. Because if we accept that placebo even is 50% effective, right, we know that by telling someone in a predictive way, here's how this is going to affect you. In a positive way, that's true. And in a negative way, that's true. And so we prime the system that way. And so again, it's really just about orienting so that clients have more choice. And so interoception many of the signals come from what we are being exposed to externally, and what our lens of neuroception, how it is primed. Is it primed because I'm in a more parasympathetic state and that loud truck that just went by, sometimes it might have startled me. Right now it's not, because I'm feeling pretty relaxed. But that, if I was in a stress state, my gut would have tightened, right? It actually kicks out a chemical signal that says I might not be safe, right? And so those chemical experiences, once those are in the body and the signals going up the vagus nerve, which we're going to talk a bit about, once that's happening, of course, the brain is a prediction and history organ, pardon me. And so, then the next thing is, okay, am I safe? Am I not safe? That reminds me of this is related to this might be about to happen. And then what comes out is often, a behavior or an expression or an emotion. And a lot of times that is where diagnoses are happening, right? And this was really true when I worked with children, because children are so 50% of my patient base has been children for the past 20 years. And things that go in right away come back out, right? So I saw that with when we altered their environments, whether it was lighting changes, texture changes, especially with food, things just changed so quickly. And then they were changing their diagnosis, right? And they were changing their capacity and their connection. When I started learning about polyvagal theory, it was really because I learned about SSP, his Dr. Porges's Safe and Sound protocol first. And what I saw when I was working with non-speaking autistic children, which was a significant part of the children who came to see me, first we were giving them the SSP and also addressing some diet and supplementation and neural supports, but I would watch them and their state change, right, over time. And then there was this one little boy who would not put the headphones on, didn't want to hear the music even over the speakers. And so I put it on the mom. And the mom said the next day, her child gave her a hug willingly for the first time. And so that is really the foundation of how I understood what I call the family nervous system, right? And how when we work with families in general, families from the top down, even how much the children can shift and how behavior can change when the inputs around them, including other people, change, right?